I would like to hear your opinion on it. How would you handle it if your friend tells you, confides in you, and says, please don't judge me and don't tell anyone. You're my bestie, but I want to kill myself.
Can I go ahead?
Okay.
Firstly, it's important to listen, not to respond, but to just understand what they are going through. Because until and unless we don't understand it, we might not get an idea where they are coming from. So, to just listen and understand and be empathetic towards them, not say statements like, don't kill yourself, it's okay, things will turn out well. Since I have gone through a training session for this, so rather than saying something like this, it's better to validate their emotions and not their actions. To just make them feel that you are there for them, that's very important and that's very crucial. And then
Okay.
later on, there are
Wait.
certain steps.
So, say a kid says, shit, that must really suck a lot, or that sounds terrible. One example. And the other example is, why do you want to kill yourself? I'm there for you. Which one do you think is better?
Definitely the second one. But I
Why?
think because the person is showing support for his friend or his or her friend, they're basically trying to tell them that they are there for them, and they are also looking for an answer that if you are going through this particular situation, they are looking for an answer, that is there something that they can help them with. So the question why here from a friend's perspective is basically to understand their situation.
Okay. Zeba, I want to ask you, why important? Why is doesn't seem to me important. It could be multiple things. And again, I want you to focus on these two statements because this is a real case
I
where that
think
kid has said this.
I think the child, the college going student, he or she is not going to understand the situation as much as a professional work. So when the why comes in the picture, it's from a point of view, point of view of like I understand these other things going on in your life, but you have so many people around you, like your family members, your other friends. You have so like why do you want to actually kill yourself? And the other statement was this sucks. And what's the other thing you said?
This sucks so hard. This must be so hard for you.
I think that is validating the person's feeling. So I think that might be a little better than the why, because sometimes when the person is suicidal, that person is not even able to understand his or her own emotions and actually
Hmm.
answer that why question is not. I don't think that person will be able to.
Okay.
He or she would
Okay. Thanks. I'm going to come to one by one. Okay, Mokshika, Advika, Mehak. Okay.
Uh, Maybe not a popular take over here, but I feel like maybe in the second response, there were two sentences. Why do you want to do that? And why would you want to kill yourself? You have me. For some reason, that second sentence just struck me as the wrong thing to say, because that essentially is like, you have so many things in your life to be grateful for, which is, again, we saw in that video, I have so many good things in my life, I shouldn't be depressed. So
Yes.
that would,
Absolutely.
I think, be counteractive and actually invalidate that person's feelings, and then they would start to doubt themselves, and once they start doubting themselves, it gets worse.
Okay. Thank you so much, Mokshika. Advika?
In I agree with Mokshika. Honestly, I was going to say the same thing, but um, yeah, it does sound very it sort of cancels out on why you're how you validate them, because you're plain blank telling them you have so much. Why do you want why are you trying to kill yourself?
Yeah.
There's no use
It's
Yeah.
doing
guilt
that.
trippy. It's guilt
Yeah.
trippy.
Yeah. Okay, Mehak.
Yeah, I think taking from Mokshika and Advika only. The thing is that with the first statement, we are validating what the person is feeling, and we're giving them that space that it's okay for them to share. However, with the second statement, one, we will open us an emotional catharsis at some point, which we won't be able to handle. It'll be a catharsis without a closure, which can lead to even more difficult space for the person. Second, again, saying that I'm here for you, it's going to only add a pressure that, oh, there are so many people for me, still I'm feeling a certain way.
Okay.
So it's not going to help.
Makes
And
sense.
with the first statement, we'll just try and buy some time with
You building the conversation, and fortunately what happened in this particular case in
Right.
Bangalore was that the kid said that, gosh, this sucks and this must be so massive and so horrible for you. Listen, I was just thinking this is too much for us to figure it out. Shall we talk to someone? That's how this girl's life was saved. Until date, I mean, it just happened 3 months back, but I found it to be so brilliant, the intervention. Most people, most family members and adults are not able to do that. Okay, so sort of sub part of the question, but if the person says, don't tell anyone, and has written a letter with a clear intention of hurting or ending life, what is the logic you have for sharing it with other people?
See, in this situation, the life of the person in question is more important than the relationship you have with them. So I think in that position, it would only be logical and it would be the best course of action to sideline that and put their life as a priority. In the end, later, once they find out and they're still in that fragile mental space, obviously there will be anger, there will be intense feelings of distrust, especially if you're very close to them. And that might be in some cases be counteractive,
Okay,
but I think
okay,
majorly overall it would be the
got
right
it.
course of action.
Thank you so much. All of you spoke wonderfully and aptly on this. I want to understand what we've covered so far, Seher, in abnormal psychology disorders.
So we've covered the presentations, along which we also spoke about a lot. So we covered circle of belief. We just kind of merged the lecture as
Okay,
well.
okay,
Viewers.
okay,
And then we were just gonna hop right into abnormal psych, talk about
okay.
the.
Go ahead.
Do
Go
you
ahead.
want to take over?
No. Please go ahead.
Okay, so thank you all. Those were great presentations, some great points that we've had. Now we're gonna jump right into abnormal psychology, but before we get into the disorders, the different categories of disorders and everything, I want to talk about the dark triad, which is essentially, has anyone ever heard of it? Okay. So are you guys familiar with the term narcissism? Psychopaths? And now this may be a tricky one. It took me years to learn this word alone, so it's fine if you guys haven't heard it. It's Machiavellianism. Am I pronouncing it right? See, it's still such a tongue twister for me.
Machiavellianism.
Yes, correct. Thank you, Mokshika. So these three together, they're three overlapping yet distinct personalities, right? And they all have one thing in common, which is, insensitivity, to say the least. There's disagreeableness and insensitivity. These are the two common elements which you find in all three. But that being said, narcissism is still different from the other two in that it stems out of insecurities. And for the other two, can you guys differentiate between a sociopath and a psychopath before we get into definitions? This is a very tricky one.
I'll go.
Yeah, go.
I think a sociopath is aware and acknowledges what he or she is doing, but a psychopath doesn't really understand the implications of his or her actions on other person's life. So I think that is a difference.
Sindhu, we can't hear you.
Yeah.
I'm sorry. I just wanted to understand what you explained right now. You said that sociopaths are what? Can
They
I have
are
you?
kind of so they are kind of aware of their actions and how it's going to implicate on other person's life, and like they are kind of aware. But psychopaths, the awareness is absent, so they are actually doing things, but they don't really understand the implications going to have on that other person's life, and what they are going to do with that person and their family and everything, all of those factors.
Okay. One of the biggest, from a clinician's point of view, the only big difference between sociopaths and psychopaths. First of all, they're all put under ASPD. antisocial personality disorder. They're not separate. The biggest difference is sociopaths are made, psychopaths are born. Never forget that. I was told this by my professor who's done years of research into psychopathology. A psychopath is born with very clear genetic traits, neurocircuit wiring, an absence of mirror neurons, and an absence of, an ability to feel remorse. A sociopath could have all of that, but all of the sociopaths have gone through significant pain, loneliness, trauma, reactive attachment issues, poor relationship with family, and their own place in society has been subjugated in some way. So sociopaths are made.
It's environmental, as opposed to a psychopath who that would be more of a genetic component to it. So I want to quickly watch this short video, which will paint a very clear picture of this 11-year-old girl. In fact, it was Sindhu had taught me this. It was about this 11-year-old case of a psychopath, and it was documented in the US, and it's depicted very well in this clip. So I'm just going to quickly play that, and then we'll discuss what we saw and how it. Why is my electricity so weird? I am so sorry. This keeps happening again and again. Can you guys hear me? Yeah?
Yeah.
Okay. I'm going to quickly play the video.
Just me. But I swear it'll never happen again. Please don't take him away.
So what are you saying? That I'm lying? The marks on Calvin's neck aren't abrasions.
Is it pausing a lot for anyone else?
Yeah, I was about to say.
He was having.
Is it lagging?
Yeah.
A lot.
Let me see if I have that video so I can play.
Yeah, or else here you can share it on the WhatsApp group. We all can watch it and like be back here to discuss.
Yeah, it's already in the WhatsApp group. Go to
Okay.
internship video clips.
I changed my Wi-Fi. I switched Wi-Fis. So
Okay.
hopefully this should work better. Should I
Okay.
play from the beginning again?
No, so just the context, there is a child, I think this is where it begins, no? The parents are being talked to by the
Yeah.
psychiatrist.
Yeah,
Okay,
basically
no.
that to give you context, their son is in hospital. He'd been strangulated, and they want to get down to the bottom of how it happened.
Tantrum.
Okay, just FYI, reward system or reward behavioral therapy does not work for psychopaths. Okay, or ASPD. Because you decide the award or the reward and they have no attachment to it. So it doesn't work at all because the locus of control must remain with them at all times. That's what they're striving for them to have that locus of control. Everything else is a manipulation. And it is damn near impossible to correct someone who's a psychopath. But here's the thing, the reason they function very well in society is because most people stay away from someone who's manipulative, deceitful, remorseless, and they end up as criminals. So they get land in jail a lot of times, or in cases of sociopaths, they actually end up heading big organizations. So these are the people who do scams worth billions and trillions, or wage wars against other countries, or lead some countries. I want us to discuss a lot more about sociopaths and psychopaths. So go ahead, anybody who wants to start.
So Trump.
Yeah, sure. Though I don't think he has any of the ASPD tendencies.
I think
He's-
he's all more narcissistic.
Yeah, even I think him more NPD than anything else.
We'll discuss all of them in detail.
What about Bin Laden?
So you have to separate criminal people from psychopaths. So a lot of criminals may have a change of heart, a change of moral compass while they are serving their sentence, or they have a moment of realization. I do not know about Bin Laden, but I know that he had a very clear directive. Psychopaths have only individual directives, clear paths of going there. They don't have communal directions. Bin Laden was more about ideologic, he wanted to push his ideology. He wanted to bring about a change in the way people related to certain things. So he had a manifesto. Psychopaths are lone operators largely.
And so Hitler wouldn't come under that either.
Less likely. Most of these world leaders are not. So serial killers come. Ted Bundy.
Dharma.
Yeah, terrible show though. Okay. All right. I haven't heard a word from Maitri and Mihir in a while. Okay, Mihir, unmute, please. Share your thoughts. Any thoughts?
Like, what is the cure for psychopaths? Because you just said that it's biological, right? And how do
There
you?
is no cure. So we do course correction. So first of all, look, most of us clinicians wouldn't have seen psychopaths because they would typically be, like I said, serial killers or criminals that would have gone through forensic psychologists and criminal profiling. So they would be put away. So putting them away is one of the ways society deals with it. But look, I think there is a fair bit of hope in something that's emerging as transference therapy and attachment therapy, okay? Where the therapist uses themselves as the object of change for the other person. So basically, if the guy who's sitting across me can trust me, only me, I will build that relationship with him in order to start now changing or manipulating him to change. That there is some research paper on it about transference and attachment therapy being used for ASPD cases. But ASPD people are so smart that they are able to figure out if you are using that. So it's damn difficult. But we have used it on borderline personality and narcissistic personality, and it's worked very well. Yes.
Wouldn't that potentially put the professional in danger?
Yeah, absolutely. Yes, but then you are dealing with a psychopath. You are in line of great fire. And typically a forensic psychologist would be doing it, or somebody appointed by the jail or the system, judicial system. So they would take into consideration certain safeties. Okay, who else? Maitreyi? Is it scary for you guys to know about psychopaths and sociopaths?
No.
Is it interesting? Because it fascinated me when I started learning about it 20 years back.
Yeah, it does.
It's fascinating, no? How the
Yeah.
brain can work.
Yeah.
And sociopaths, on the other hand, Seher, if you would please add, I mean, they have a lot of similar traits, but different too. So can we talk a little bit about sociopaths?
I have one doubt about sociopaths. So I'm a big fan of the show Sherlock. And there's a very popular quote from it. I'm not a psychopath. I'm a high functioning sociopath. Do your research. So do you think he is actually a sociopath, or was that line just thrown in there?
No, so people who are sociopaths take it very personally when they call psychopaths, because what they're also turning your attention towards is you made me. You, the society has made me. I'm not evil because I was born this way. Joker was Joker not because he was born this way. He had his origin story. So that's the whole pull that, don't call me a psychopath. I'm a sociopath. I was hurt by the same society that wants me now to behave a certain way, right?
So Sherlock would be categorized as a sociopath.
I haven't seen the show, but if he has said it, I would assume he's a sociopath.
Yeah, he said that.
Okay.
So sociopaths, they may engage in criminal behavior, but a lot of their actions, they're more spontaneous and a lot more disorganized as opposed to, a psychopath whose actions may be a little more calculative, a little more manipulative. Again, like I said, psychopaths are born that way. Their brain circuitry lacks the ability to process emotion, remorse, all that. It's part of their limbic system, which is where all the emotional processing is done. That is the part and that, again, I know we spoke about the amygdala before in the, different part. Yeah, go ahead, Maitri. Mokshika, you
No,
think?
no, that wasn't a hand raise. It was a
Oh, okay. Yeah, but essentially it's that part of the brain that's just not functional. So they don't feel remorse, they don't feel, guilt, they don't feel shame, they don't feel any of that because they can't process those emotions. They don't understand the meaning of actions and consequences. They don't know how to associate the two. They just
Yeah.
live as freely as they can at their own terms,
Yeah.
on their own terms.
A sociopath would be able to close a lot of deals by harnessing very good relationships as long as it works for them. So they have disregard for other people's social equity, their standing, their emotions. But if it serves them in society, they're going to utilize and harness these relationships. Psychopaths are driven so single-handedly and unipolarly by their own agenda that they would never consider anyone else. So there is that difference. So sociopaths will see what works for them. So they will, like a CEO who will, who's, say, a sociopath would strike certain deals or play nice or even engage with you and give you compliments and do all of that and apologize if it works in their favor, but they won't actually feel it. Do you know why we don't see sociopaths and psychopaths in therapy? Anybody? Or narcissistic people? Why don't we see narcissistic people? Why don't we see any of these people in therapy? Yes,
maybe
Nisha?
It's a bit difficult to detect them because of their charm and their ability to manipulate people.
Okay, I'm looking for a much more, I'm looking for a word that you guys may have learned in college.
Can I go ahead?
Yeah.
Yeah, I think it's the insight. They do not think that it's a problem. They don't think that
So
they
they
need.
lack insight. You're getting closer to the answer. So they lack insight. But what is that word we learned, you might have learned in probably school or college? Okay, Mehak?
Remorse. They don't
No. Has anybody heard the word egocentric or ego dystonic? Okay. So people with dark triad, like what Sarah was explaining in the beginning, Machiavellism, whatever that's called. And the second one is psychopathy, and the third one is NPD, or even BPD. All of these people, BPD is a lighter version, really. But the dark triad, they're never in therapy because look, how they're behaving or what they believe in, it sits very well with their idea of self. So there is no ego conflict. There is no ego dystonicity. So it's ego-syntonic, which means it matches very well with my ego or internal sense of self. I am not doing any wrong. I am not hurting people. I am just driving my own, principles. I'm driving by what are my desires or urges are. How can I be wrong? Why do I need to see you for? So I think 2 weeks back, I saw a father who is an NPD case. Obviously, he didn't come for himself. He came for his daughter, who he said is out of his hand and misbehaving because she wouldn't listen to him or she's being unreasonable, blah, blah, lots of things. He genuinely doesn't believe that punishing her using physical means or in one particular case, sexual coercion was wrong. He felt absolutely okay with it because he said, I needed to do something in order to correct her. So if I can correct her, my agenda is met with. So the point is, he didn't come for himself, but we could identify because he had zero remorse about anything. He had complete disdain for familial attachments. All he wanted was his wife and his daughter to adhere to standards or protocols or principles, he said. As long as people towed that line, it was fine. And if the girl or the child did not, she was punished by, in an act of severe sexual coercion, boots on her private parts, and then physically abused as well. And all of this made sense to him. Everything made sense to him. So the point being, narcissistic people do not seek diagnosis. We seek them out in order to figure out what's wrong. So it's ego syntonic and ego dystonic are the two important concepts I wanted you to understand. Yes, Mokshika.
How do we manage cases like the one you just described? What if the
Which
parent is not?
that, without getting much into details of that, currently we are doing family intervention, which we have said mandatory involves therapy sessions and assessments for the father, the mother, the child. Now, we know that the moment we run an MCMI or MMPI on the father, we'll figure out he's an NPD. Or we will somehow come up with clinical investigations to support our claim. Look, a lot of times we are like that doctor in that show. We will bend the system to support the patient. So we know this is a clear NPD and there is abuse.
What if they deny therapy? What if they deny all of this?
No, so it's not for them. So when we present the idea to them, we never say, oh, we want you better. Oh, we don't want to touch you. You're perfect. We want the daughter to get better.
What if he figures it out?
He will, no, he won't figure it out. So now it depends on the rapport between the therapist and that man. NPD is not that hard to manage in therapy because, like I was talking about, transference and attachment therapy, that's one of the parts. The second is CBT. Certain tools really help. At the end of the day, look, the therapist doesn't want to change his personality type. We want the abuse to stop. We want the child to do it. What's my objective? We want this family dynamic to improve. So very realistic expectation. Want the family dynamic to improve. There should be no violation of, boundaries, and there should be safety. And the child needs to get out of the house, go to college, and do her thing. We want the wife to be at peace. We want her to be safe too, right? My objective is not to change this man. So in therapy, or in psychology or behavioral sciences, many, many times you will come across this moral dilemma or a wall that'll beg you to question what you've learned in college. You'll question everything. Everything you've known or people have told you about, something as simple as we've always, everybody says, oh, therapists should not take anything from their clients. You can't break that. Right? You have to be absolutely clear and have a boundary. But look, if you're working in North India, people are going to get mangoes and katal and palak from their gardens and farms to your clinic and gift it to you. In a collective culture, it works differently. Problem is, we are trained so much in Western style of providing therapy. Wouldn't you say that, Seher? That a lot of our therapeutic understanding comes from the Western world.
Yeah, this is what Mehak and I actually discussed literally yesterday on the phone.
Yeah, I wish we had more examples from the Indian context or shows that are relevant. I would love for you guys to find me clips about that, anything that you can. Like, I remember this movie, a little bit about this movie where Deepika Padukone has an anxiety attack or a panic attack, is it? Sorry?
Cocktail, I think.
No. Gehraiyan, where she has trauma-based responses, I think.
Right.
Is it trauma? I remember that particular scene. So if you can find Indian cases, Indian shows that highlight some of these things, I would love for us to look at it and talk about how do we approach in therapy.
I have one. there's this Akshay Kumar movie, Katputli. I don't know if anyone has seen it, but basically in that, I guess seen it, so I think she'll be able to explain it better because I can only see it from the movie viewer's point of view and not a psychologist's point of view. Basically, in that,
Yeah.
basically
Okay.
in that, yeah.
Go ahead. Go ahead.
So basically, in that movie, there's this serial killer who abducts girls that fit a certain profile, and
Okay.
he hurts them in a very specific manner. The scars, the way he cuts them, the way he damages them is very, very precise. And then he takes a doll and does the exact same thing to that doll's face and then puts it wherever she was abducted from. And then a
Okay.
body turns up 2 days later. So basically, it was that this guy was masquerading as this mute musician, no, sorry, magician, who would
Hmm.
come to a school and scope out the girl.
Okay. So I suppose in a series and movies, there must be a lot of cases like dissociative hysteria in that movie by Vidya Balan.
Bhul Bhulaiya.
Yeah. People, and that's something we want to start the next session with, not Vidya Balan and that, but dissociative hysteria. And because we're going to continue talking about abnormal psychology.
But
So
honestly, I have
what
to
I'm hearing is, so what I'm
Say
hearing,
what? Sorry?
sorry, I was just gonna say I have to admit this. One of the biggest reasons I ever got interested in psychology, I'm kind of embarrassed to admit it too, was Bhul Bhulaiya.
Okay. I don't want you to put that on your resume or on an
Never.
appraisal.
I get called Manjulika unironically.
Not a compliment.
I know.
Okay. Okay, but it is dissociative hysteria, which I want to dive into. So, Sarah, if we can talk about dissociative identity disorder, what people call multiple personality disorder. I want to talk about interesting stuff. And I also want to have questions from you about cases, about any curious questions you have about how to handle a friend, a family member, anything at all. Okay? I'll see you all next week. No. When do I see them?
Friday.
Okay, thank you. I'll see you all on Friday. Bye.
Bye-bye, guys.
Bye.
Bye bye.